Assalamualaikum warahmatullahi wabarakatuh. My name is Ain Syafiqah binti Asri. Today, I want to present the importance of maintaining a healthy heart. My group consists of 6 members, which is me, Ain Syafiqah binti Asri, Humayraa Hindi, Widad Hanani, Badri Qusyairi, Akmal Fadhilah, and Asyraf. The aim for this study is to study the relationship between dietary habits and lifestyle with healthy of the hearts among the locals. The content of this slide is type of disease, cause of heart disease, ways to prevent heart disease, and other related matters and conclusions. For introduction, since 2005, heart disease remains as one of the main causes of death among Malaysians. This problem is closely related to their dietary habits and lifestyle.
Firstly, I want to present about type of heart disease. Before that, heart disease refers to any condition affecting the cardiovascular system. There are several different types of heart disease that affect the heart and blood vessel in different ways. Firstly is coronary artery disease. Second is arrhythmia disease. Third is heart failure. Fourth is cardiomyopathy or heart muscle disease. Fifth is heart wave disease. And lastly is congenital heart disease. Next, we move to the first type of heart disease. It is coronary artery disease. What is coronary artery disease? Coronary artery disease, also known as coronary heart disease. It is a most common type of heart disease. It develops when the coronary arteries become too narrow or cholesterol blockage develop in the walls. The coronary arteries are the blood vessels that supply oxygen and blood to the heart. Next, what causes of coronary artery disease? It is caused by plaque buildup in the wall of the arteries that supply blood to the heart. Plaque is made up of deposits of cholesterol and other substances in the artery. Then, once the inner wall of artery is damaged, fatty deposits or plaque made of cholesterol and other cellular waste products tend to collect at the site of injury. This process is called arterosclerosis. If the plaque surface breaks or ruptures, blood cells called platelets clump together at the site to try to repair the artery. This clump can block the artery, leading to a heart attack. Next, what is the symptom of coronary artery disease? Firstly is heart attack. Second is angina or chest pain. Angina or chest pain is the most common symptom of coronary artery disease. Angina can happen when too much plaque builds up inside arteries. Then, we move to the next slide of type of heart disease. It is arrhythmia disease. What is arrhythmia? An arrhythmia is a problem with the rate of rhythm of your heartbeat. It means that your heart beats too quickly, too slowly, or with an irregular pattern. When the heart beats faster than normal, it is called tachycardia. When the heart beats too slowly, it is called bradycardia. The most common type of arrhythmia is atrial fibrillation, which causes an irregular heartbeat. Arrhythmia causes when coronary artery disease. Second is high blood pressure, wave disorder, injury from a heart attack, and the healing process after surgery. Next is symptom of arrhythmia. Firstly is fast or slow heartbeat. Second, skipping beats, chest pain, shortness of breath, and sweating.
Okay, so the next type of heart disease is heart failure. What is heart failure? Heart failure occurs when the heart muscle doesn't pump blood as well as it should. Symptoms: shortness of breath with activity or when lying down, rapid or irregular heartbeat, and the next is cardiomyopathy. What is the cardiomyopathy? It is a condition that affects your heart muscle. If you have cardiomyopathy, your heart cannot efficiently pump blood to the rest of your body. Types: dilated cardiomyopathy, hypertrophic cardiomyopathy, arrhythmogenic right ventricular dysplasia, restrictive cardiomyopathy. Causes: ischemic cardiomyopathy caused by heart attack or coronary artery disease (CAD). And the next is non-ischemic cardiomyopathy and types unrelated to CAD. Symptoms: fatigue, heart palpitation, shortness of breath, swelling in the legs, calf or ankles. And the last one is heart valve disease. It causes the four heart valves which keep blood flowing in the right direction are the mitral, tricuspid, pulmonary, and aortic valve. Each valve has flaps, leaflets that open and close once per heartbeat. If one or more the valve fail to open or close properly, the blood flow through your heart to your body is disrupted. Symptoms: irregular heartbeat, chest pain, fatigue, shortness of breath, particularly when active or lying down, swelling of your ankle and feet. And I will pass it to the next presenter, Ain Syafiqah.
As a heart disease is congenital heart disease. What is congenital heart disease? It's a problem with the heart structure that exists in birth. Congenital means born with a defect. It also called congenital heart defect. It can change the way blood flows through your heart. The causes of this disease is some congenital heart disease are passed down through the families. When something disrupts the normal development of the heart is the cause of this disease too. The symptoms of this disease is rapid heartbeat, rapid breathing, swelling of the legs, stomach or around the eyes, and extreme tiredness and fatigue.
Cause of heart disease. Aging. As people their cardiovascular system become weaker. Genetic. People who have direct family members that have had heart disease are at the higher risk of developing it themselves. Lifestyle. Aspect of everyday life from work stress to lack of exercise and tension can increase the risk of heart disease. Gender. Men are 3 to 5 times more likely to develop heart disease than women. Smoking. Denatine and carbon monoxide increase the heart rate, lower than oxygen level in heart muscle, and can cause thrombosis. Diabetes. Hypertension and blood glucose can lead to angiocorosis and damage to tunicles intima. Diet. Food rich in fat, salt, and sugar, as well as food containing alcohol, increase the risk of angiocorosis and can cause high blood pressure.
Okay, third way to prevent heart disease. Okay, number one is eat a healthy diet. 2. Be physically active. 3. Watch your body mass index. 4. Life tobacco free. 5. Many conditions, especially to the people who have high blood pressure, hypertension, high cholesterol, high blood sugar, diabetes, or other condition that put you at greater risk. It's very important to make lifestyle change to a better one. Okay, 6. Take your medicine. 7. Get good quality sleep. 8. Get regular heart screening. 9. Study about the disease. And lastly is be positive.
Now I will explain about the other thing related to the heart disease. First is the symptom. There are many other symptoms as there are different type of heart disease. For the example, is symptom of heart disease in your blood vessel. First, chest pain, chest tightness, chest pressure and discomfort. Second is the shortness of breath. Third, pain, numbness, weakness or coolness in your leg or arm if the blood vessel induced part of your body are narrow. And lastly is pain in the neck, throat, upper abdomen or back. Other example for the symptom is the symptom of heart disease caused by abnormal heartbeat. First, fluttering in your chest. Second, racing heartbeat. Third, slow heartbeat. Fourth, chest pain or discomfort. Fifth, dizziness. And lastly is the shortness of breath. There also fact about the heart disease. First, heart disease cause about 1 in 4 deaths, which is 610,000 people in United States each year. Second, heart disease is considered as one of the top preventable cause of death. Third, it say that aerobatic exercise is the best exercise for the heart disease patient. Fourth, Japan, Korea and France have the lowest heart disease issue. And lastly, about 137 mummies have been studied to study how long heart disease has existed.
So, the conclusion of this slide presentation is heart disease is a serious condition caused by the build-up of fatty deposits within the walls of the vital arteries that supplies blood to the heart. Coronary artery disease is the major cause of death. Heart disease is a major killer that can in fact be controlled if we apply the ways to prevent it.